Mr. Chairperson, Dr. Michael Scott, Deputy Vice Chancellor, Professor Ivalo Griffith, 10th Vice Chancellor and Principal, University of Guyana, Dr. William Adeko, and other members of PAO, WHO, and UNICEF, Moderator Dr. Paloma Mohammed, Deputy Vice Chancellor, members or fellow moderators here, panelists, ladies and gentlemen, members of the media. I am indeed happy to be here at this second Turkine and Theme Talks. Guyanese lives matter, mental health matters, preventing suicide in Guyana. I'm asked to speak for 10 minutes on experience and/or responses to mental health and suicide in Guyana. To let you know that Guyana joins the international community only a few days ago in observing World Suicide Prevention Day in 2016 under the theme Connect, Communicate and Care. And this is the approach I will adopt to present to you our response, that is the Ministry of Public Health, to mental health and suicide in Guyana. In response to the suicide phenomenon, and that's how I prefer to refer to it as, multiple actions that are included in the National Suicide Prevention Program, which was launched last year, have been initiated and are being currently implemented. What is important to note, and I guess most of you will agree with me, is the multi-sectorial approach to suicide prevention. This has placed focus on 4 strategic action areas, and that is in our National Prevention of Suicide Strategy. And I refer to risk factor reduction and health promotions and prevention, to reducing access to means of suicide by improving health systems and response to suicidal behavior. Fourthly, strengthen surveillance and research on suicides in Guyana. I am happy about the multi-sectorial approach because we can see the logics and the practicality of that. When we initiated this process, we had involved from the government alone, the Ministry of Public Health, of course, but we also had education, we had social protection, we had public security, we had Ministry of Agriculture, and of course, Indigenous Affairs. I would like to go back to the theme of the World Suicide Prevention Day, which comprises of 3 very important facets of suicide prevention. And it's the need to connect and to communicate with, as well as care for those who have lost loved ones as a result of suicide, or those who themselves have contemplated suicide. This is pivotal to fight and to prevent this scourge. In my experience, and this might be for most of you, oftentimes we find persons distancing themselves from those who reach out for help and want to share their sadness and hopelessness as it relates to their future. Whether persons do so because of their reluctance to listen or because they are pressed for time, this certainly is not the way to go. So persons need to connect with their friends, with their relatives, their neighbors and colleagues, and empathize with them during their times of distress. We have to be our brothers' keepers, and forgive me for not saying sisters. Those who have lost a loved one to suicide or have been suicidal themselves need our support. The simple act of keeping an eye out for them and asking if they are okay can make a big difference. It can even save a life. Asking someone, expressing some concern can be a life-saving act. Connecting persons who have been directly or indirectly affected by suicide with a strong support base can go a very far way. This is where everyone in our society can play a role. Even though the circumstances and interplay of events which leads person to the point of feeling suicidal is complex, there are some commonalities. By telling their story, persons who have been suicidal themselves can provide insight for those who have lost someone to suicide or supported someone who was suicidal. They can also provide insight into what helped them to choose to live rather than to commit suicide. Communication. Communication also plays a vital role in suicide prevention. And while it's a sensitive topic, it is important that we discuss suicide as we would any other public health issue. Speaking of this scourge in hushed tones and in some cases avoiding discussions completely does no good for society. Open discussions about suicide can help to clear up misconceptions, reduce stigma, and encourage persons to seek help. Having suicidal thoughts should never be a secret between oneself and God. However, persons need to be taught how to communicate effectively with those who are at risk of committing suicides, because we can end up causing more harm than good. While open discussions about suicides are important, it is equally important that persons take heed when speaking or writing about this sensitive issue. The media in particular must pay attention to what is reported when it comes to cases of suicide. And I will make no attempt to lecture the media. I might have had an opportunity when it was pertinent for me to beg the media. I did not. I am doing so now. I'm begging that there's absolutely no need to include details such as names, addresses, photographs of victims. And I have seen where someone committed suicide by an entirely different means, but a photograph of a noose was there pictured. Totally irrelevant, totally not productive. Such reckless reporting can contribute to copycat cases. No doubt about it. 3 young boys across the world that we know about committed suicide by hanging after seeing that stolen part of hanging of Saddam Hussein. and that certainly could have been prevented. Media recommendations have been developed recently by PAHO WHO office to assist journalists in getting adequate reports and news related to suicidal behavior. We again are calling on the media, who have such an important role to play in suicide prevention, to continue with responsible reporting. If we are serious about reducing the incidence of suicide in our country, in our dear land of Guyana, then we need to do more than connect and communicate. We need to care. Dr. Henry said she's visited the Fort Kanji Psychiatric Hospital. I have been there for almost on 7 occasions since I took office, which is about 15 months. And I'm saying this to you, that Guyana have failed the people in that institution. Dr. Harry will tell you that patients there are discharged, but they're not taken by their relatives. When a patient died at the Fort Kanji Psychiatric Hospitals, only the inmates and the staff attend that funeral. Persons leave the Fort Kanji Psychiatric Hospital, go home, and voluntarily go back to the psychiatric hospital. And I'm saying this with no apologies, that that place is not fit for human consumption. I don't know how we're going to work on it, but I was recently informed by PAHO WHO, they have the authority to do so, that we no longer build psychiatric hospital. So with my effort to try to access funding, to just remove it, and I use the term in inverted commas, bulldoze that institution and build a new one which is really, really better than that one, might not be the best thing to do. But I don't know if in the Guyanese context we can do without going down that line. The government of Guyana cares enough to have suicide on the front burner, and this is very much emphasized with respect to prevention. Suicide prevention is possible because most of the persons would have made contact with a health professional within 1 year of their demise. And this is why it is very important that we improve our screening of depressed persons at all healthcare facilities right across the country. While I agree, yes, we need a psychiatrist, we need the psychologist, we need the social worker, but we don't have to have them in every health institution before we can provide mental health issues. The psychologist said to me that the problem lies in the community. But he also went on to say that the problem of the solution also lies there. And that is the approach we're taking, creating a stronger primary mental health program right across the country. Mental disorders and harmful use of alcohol contribute to many suicides around the world. Early identification and effective management are key to ensuring that people receive the care they need. At all times, the appropriate and effective treatment which is available must be given. For national response to be effective, as I said before, that multi-sectorial approach to suicide is necessary. And of course, restricting access to the means of suicide. We will ask about what the Ministry of Agriculture is doing. From our last report and a presentation by the Ministry of Agriculture, they are much more effective here in Guyana than most of the Caribbean countries. And that is why suicide is a complex problem. We have put measures in place, and I know it is so, but that's only one aspect of it. We've got so much more work to do. So while I agree, yes, that we're moving in that direction, it will take some more time. Of course, time is of essence. An effective strategy an effective strategy preventing suicides and suicide attempts to restrict access to the most common means. But it's not only pesticides and insecticides that we have to. Firearms, medication, and those are some of the things in my little village of Baramita. It's a bad thing to see a piece of rope, because that is what they use. They don't use insecticides and pesticides there. They use the rope to hang themselves. And I'm saying this to you because it affects me. The youngest attempt at suicide was 6 years of age. The youngest successful is 11. And we talk about, what is happening there. I spoke about alcohol. But that, with studies there. The people in the village of Baramita was waiting at the end of every 6 weeks to know who next. Because it was one suicide every 6 weeks. And that's a reality. And that's why we have to go on the ground to see what we can do in every aspect of it. And when we might have to make some hard decisions, controversial decisions, and I can tell you that I'm no stranger to controversy of this thing. So we have got to make decisions with regards to the sale of alcohol. I am taking the anti-tobacco bill to Parliament shortly. But alcohol is a big man. I'm telling you this where suicide is concerned. Suicide can be prevented, and we at the Ministry of Public Health want persons who are despairing and thinking about suicide to know that there is help available. The Ministry has some 16 satellite clinics in all regions, with the exception of Region 8, and I can assure that with Dr. Harry's insistence, that will be only a question of time before we get it there. And at these health facilities, health services are available. Persons can also call the toll-free numbers on the 24-hour suicide prevention helplines. It might not be the best. It was never there, it's there now. And we had success. And we're going to continue to have success. There is help, and the earlier it is sought, it is the better. Every case of suicide is one too many. Prevention of suicide is everybody's business. I'm so thankful for this opportunity. I had to be here tonight in spite of having to travel many long hours on the river to get here. Because to me and the Ministry of Public Health, suicide is very important. We can all be heroes. We can save lives and restore hopes. We must connect, communicate, and care, not only on World Suicide Prevention Day, but every day. That is the way. Thank you very much.